I was under Professor Brunt since 2015, December 2015. That was when I was first diagnosed with breast cancer. And he retired, and I first had a telephone consultation in March 2020 with Dr Jegannathen. It was a telephone conversation because we were in lockdown with COVID. So that was the first contact I had with Dr. Jegannathen. And then as soon as possible, I was able to meet with her at the Nuffield Hospital in Newcastle-under-Lyme in Clayton. And I've just been so pleased with her manner, her communication skills with patients. It's just brilliant. She explains everything in great detail. She shows me on her computer screen scans that I've had and explains them fully. She'll draw me diagrams if I'm asking questions about where things are. So that's absolutely brilliant. There's always a specialist breast care nurse present in the room during my consultations with Dr. Jegannathen. And I'm very, very familiar with this lady. And she reiterates constantly what Dr. Jegannathen is saying. And she will also always say that she is my point of contact if I ever need her or have questions that pop up after the consultation that I've thought about. So there's that brilliant teamwork that's very visible within the hospital. So I'm just absolutely over the moon with how she works with me. She always greets me so warmly, as if I've known her for all my life. And you get this real impression that she is so invested in individual patients. She knows your name. She knows exactly what stage you're at with your treatment. She gives me scans every 3 months. She always as well tries to include, well, she does, not tries to, she does include me in the decision process. So she'll put forward different options, and I definitely feel like I have a say in things, and we'll discuss things. So ultimately, though, I understand that she's a professional and I am definitely in her hands, and I will go with whatever she says at the end of the day, because I know that she's got my best interests at heart. She does incredible fundraising activities as well, constantly. She also is, she's a musician, and she sends films of her performing to her patients, and that sort of acts as a mindfulness activity, which is really nice. So she's very much involved, I think, with the holistic help that she can give me. So yeah, I'm just over the moon with how she operates. Well, I just feel blessed that I've got a consultant like Dr. Jegannathen, who, as I say, has is just invested in her patients. So, I'm lucky because I have private medical insurance, and I just feel that the treatment process, the scans, the appointments, the waiting time for the results is so much shorter than NHS patients. obviously, for most of my life, I've been an NHS patient. And, I'm not knocking the NHS at all, but I understand they're under incredible strain. But I just feel blessed that I have this opportunity to have this service, if you like. And I just can't recommend Dr. Jegannathen more highly. She's just wonderful.